Have you ever wondered why some patients seem so resistant to care, no matter how much time you spend encouraging them? Hi, I'm Katie Pudwill, and I am a dental hygienist and an educator from South Dakota. I'm passionate about helping clinicians transform the way that we communicate with our patients. In this video, I want to share how motivational interviewing and trauma-informed care can turn those difficult interactions into opportunities for healing, connection, and long-term behavior change. In dentistry, we often encounter patients that seem disengaged. They might miss appointments or don't follow through with home care recommendations. But what if their behavior wasn't about noncompliance? What if it was merely about survival? Adverse childhood experiences can affect us all the way into adulthood. Things like abuse, neglect, and household dysfunction, especially when we are young, can biologically alter how someone responds to stress, pain, and even authority. For dental patients, this often shows up as anxiety, avoidance, or a deep mistrust of the healthcare community. Understanding ACEs is critical for our understanding of how our patients encounter the world around us. That's where motivational interviewing and trauma-informed care come into play. We can use MI as a collaborative, patient-centered communication style. It helps evoke patients' own reasons for change. Trauma-informed care helps providers understand how past trauma can be affecting the patient today. It emphasizes safety, trust, and emotional awareness. When we integrate MI and trauma-informed care into our everyday clinical routines, we create safer, more responsive environments for patients to thrive. And when they feel safe, we are able to promote sustainable behavior change. So what does this look like in practice? It could be as simple as asking a parent, what's most important to you about your child's health? It also means noticing signs of stress. When we can recognize stress and coping behaviors in patients, we can co-regulate with them so that way they feel safer in our chair. It also means connecting patients to local community resources that they need. This can include the Suicide and Crisis Lifeline, as well as local behavioral health clinics. Positive dental experiences, especially with people who have dealt with trauma, can become counter ACEs that help build resilience and work towards positive behaviors. Join me at the ADHA annual conference to explore this further and practice these skills hands-on. I'm leading a workshop on trauma-informed care with the underlying ACEs foundation. Let's reimagine what it means to care for the whole patient, not just their smile.